reach out to the snake. And when he did that, he got bit one time. You would think he would stop, right? No. Yes. So, and it was funny. So he got bitten 5 times. And then, and after that, you would think he would come to the hospital. No, he won't go to the hospital. He'll be fine. Not until all of a sudden, his temperature is, everything started going bad. And his wife is like, we got to go now. And even that, he will not let his wife call 911 and have him pick up. So basically, they drove to the hospital. Okay. So when they got there, the ER physician was like, "How can that be? 5 times on your hands." So we're trying to find out from him as to what happened. He will not say. And so it was funny. One of my colleagues said, "I know what happened." And it's like, "How do you know? You weren't there." He says, "I know exactly what happened." I said, "What happened?" He says, "This guy came home and saw that, and instead of letting the snake go away, he went there trying to play with the snake, going snaky, 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 and the snake bit him. And you would think he would stop. He won't. He kept going. Well, so when he was brought to the hospital, as a matter of fact, he was in bad shape. Okay? So the doctor, the ER physician called. He didn't know, the ER physician didn't know what to do, to be honest. So he called it to the main pharmacy, and I happened to be around. And he said, "Ken, I have a patient here, and I need something in emergency." And I said, "What happened?" He says, "This guy's been bitten by a snake, and he is turning blue. Basically, everything is failing. His kidney was failing. Everything was beginning to fail. And so what do you have to help me give it to this guy to at least, save his life, after some time to see what we can do to resolve it?" I said, "Okay, well, we have a product that I can make it for you, but the drug comes with a hefty price, okay? So we can mix it. It dissolves very slow, but we can get it and bring it to the ER. So that's what we did. So we get together, try to mix it, send it to ICU. To ER. Unfortunately, the way the drug works is you can't. If you're bitten, if one bite. You have to use, how do I say it? You infuse, if a patient, somebody is bitten by, if you're bitten once, you have to use 1 vial. If you're bitten twice, you have to use 2 vials. 3, you have to use 3 vials. And there was 5 vials, and that drug was totally almost about $28,000. $28,000. Well, we got to do what we got to do, right? Save this guy. So we make the drug, we sent it, they infuse it, but unfortunately, that's not the only thing. Once you do that, after 3 hours, you have to go back and redo it again. Yeah, so it's continuous. So we're talking about before that guy was rushed from ER to ICU. Basically, we have spent almost over $100,000. Okay, so that night when I was leaving the hospital to go home, I kept thinking about that guy the whole night. I kept praying for this guy that I'll come back the following morning and he will be there, because it wasn't good. So when I came back the following morning, he's the first one that I went to look for his chart to see if he's still there. And yeah, he was. He was still there. But it was getting, we were able to get him stabilized. But he was still facing the challenge of dying, honestly. Anyway, so finally though, he did die. He didn't live. Okay, he did not live. But I'm saying this to say that The doctor was, I mean, the ER physician was very, very appreciative of me at that time because he didn't know what to do. So as a pharmacist, these are some of the things that we also bring to the table, okay? Doctors actually do a better job in diagnosing medication. When it comes to the drug therapy, we are the expert in it because that's what we do, okay? And we spend our time, I mean, pharmacy school studying all the detail in the pharmacology, pharmacokinetics, and everything about drugs. You know, so in the hospital, it's very, very common for doctors to reach out to us asking about our input to help alleviate some of the problems that they go through, myocardial infarction, I mean, name it, every medication, I mean, every drug, I mean, disease state, the doctors are always in collaboration with the pharmacists to try to help, to work. When we, even in the morning, when we go to the morning rounds, there's always a pharmacist with them, and they always keep asking questions. And that actually will help. When I was doing my residency the same way, this guy was dying, and then the doctor kept looking for augmentin IV, and I'm sure Rosalind know about that. Augmentin doesn't come IV, but he kept going around and running in circles looking for augmentin IV. Augmentin is an antibiotic, but it doesn't come. Luckily, that time I was a young student doing residency in VA hospital in New York. And so I said, no, that drug doesn't come in IV. You need to use either use Rucerfin or some, any of those drugs that work with it. And so when I told him, he was very happy about that. So the point I'm trying to say here is, as a pharmacist, there's a lot your pharmacy can do for you. Okay? So when you go to the pharmacy, please ask questions. Get to know your pharmacist, okay? It's very, very important that you get to know your pharmacist. Another thing also that I also want to mention pretty quick is also the use of vitamins, okay? It's also very, very important, especially these days when we all work for long hours and everything. They're very, very helpful, okay? One thing is, not all vitamins actually do absorb well, unfortunately. We got so many drug manufacturers out there making vitamins because they don't have to go through FDA scrutiny where they have to be approved. They just come out and put a slimy label on it and they start distributing it and selling it. But unfortunately, not all of them actually is going to do the job that you want them to do for you. Some of them have very, very bad. Excuse me, I have a question? I'm sorry, I barely can hear you. Okay. Okay. Unfortunately, at all. Okay. Yeah, there will be time for you to ask questions if it's okay. Okay. Yeah. Um, so these days, I'm sure you guys beginning to see it that there are a lot of hydration therapy going on around where you can be given, you can get your vitamin in an IV form, okay? Where you can get everything directly into your bloodstream to get it to work for you. Okay, I mean, they have it everywhere. I mean, actually, we are doing it in our pharmacy today. So I want you all to pay attention to that there's so many choices out there today. And the only way, if you don't know, again, ask your pharmacist. It's very, very important. I mean, that is their job. Their job is there for you. Pharmacies they are readily accessible for you. That you don't need an appointment. You can just walk to your pharmacist and ask questions. You can pick up a phone and call your pharmacist and ask questions. So, I mean, it's not like your doctor where you have to make an appointment or, Not like that. Pharmacists we are the main gate for health, people's health. I mean, I've seen it all. So please, if you have if you go to a pharmacy, don't just pick up your medicine and just walk out. Try to get to know your pharmacist. It's very, very important. Okay. What else can I think? What else can I talk about? Technology also have helped today. Back in the days, you have to walk to your doctor's office to get a prescription, paper prescription, to your pharmacy before they fill it, right? These days, technology has been very helpful. They can send a prescription electronically to your pharmacy without you even getting involved, right? And then the medication will be filled, and then they will call you. I mean, I'm sure you guys have seen it. They will text you, call you, whatever it is, for you to pick up your medicine. Okay? So there are so much technology I've done to help when it comes to drug therapy. So please, it's very important that you get to know your pharmacist. Very, very important. Okay? Get to know your pharmacist. Another thing also I want to stress also is drug use. Some people, when they pick up their medicine, I mean, there are certain medications that when you are on, you can't just, once you are on it, you can't just stop. I mean, just, like, you can't just stop. So some of them, you have to taper off, okay? You can't just stop, because then you'll face more problem, okay? And so these are some of the things that you need to be asking. So that's what I'm stressing, that you get to know your pharmacist, because if it's an antibiotic, for instance, most antibiotics, you have to finish the whole course, because if you don't, guess what? You will have a rebound. Whatever infection that we're treating, the next time you know, it is back, okay? But unfortunately, when the infection is back, the same medication that you are using, you can't use it anymore, because your system probably have built resistance to it. So they have to change the whole thing all over and start all over again, example. So, but how do you know about all this? Again, read the package insert. Ask your pharmacist questions, okay? And because that is the only way you know, okay? So at this point, I can be going on the whole day, but it's always good to try to get from you, the audience, what experiences that you guys have and questions that you have, so I can help address it for you, and hopefully it will bring everything home. Okay? So I know, Miss Lee, you have a question for me, yes.
Okay, let me see if this mic. Okay, this mic is working now.
Yes, go ahead.
All right, thank you for that information. Two questions. One is regarding vitamins, and the other one's regarding CBDs.
CBD, okay.
So as far as the vitamins, because there's tons of vitamins out there. It's like, they're by the dozens when you go into the pharmacy. Is there a special testing or like the USD code or something like that we need to be looking for before we purchase a vitamin? And should all vitamins be tested in some capacity before it is put on the shelf?
All right. Let me answer the first one.
Well, I didn't ask the second one yet, but I'll let you.
I'm sorry?
I didn't ask the second question yet, but you can answer that one.
Okay. All right. So let's start the first one, then we can do the second one, the CBD, right? CBD,
yes.
Come on, okay. Oh, okay. Stay right here. Okay. Okay. So that is one of the frustration that we as healthcare professionals, including physicians and pharmacists, that we face. And we wish that they would change the law in Congress where all medications that is being taken by mouth, that go into our bloodstream, will be tested, right? Because testing is the only way for us to know, number one, if that drug is even safe for our body, right? Because even with prescription medication, there has been some that FDA had approved it, came to the market, but then 2, 3 years, 2, 3, 4 years down the road, we found out that they causing liver failure, example, and it's been taken out. One of them is there was a drug called Resolin. It was so many years ago. There was a drug called Resolin. We used to use it for diabetes. That drug, when it first came out in the market, it was great. People were using it left and right. Doctors were writing it. We were dispensing it. But then, unfortunately, about 3 or 4 years after, we found out that that drug is causing a lot of liver failure in so many people, and the drug was taken out from the market. Okay, so yes, so we wish that the Congress would change the law and have vitamins also be tested just like any other drug. But unfortunately, we live in America. You know, in Congress, I mean, they have exceptions. You know, I'm sure that depending where they get their money from, sometimes they make certain rules and laws to make it easy for other people. So it would be nice to have that tested and passed before being put in the market. But unfortunately, it is not the law today. So anybody can just come out. I mean, there are so many drug manufacturers. Like you said, when you go to pharmacies, there are so many manufacturers for the same drug. Mm-hmm. Melatonin, for instance. Melatonin is a medication people use for sleep, right?
Yeah.
You will see that Nature's Made is making it. Convigant is making it. There's so many manufacturers making the same drug. And people come there and they're always confused. So which one do I buy? You know?
Wow.
So that's the answer to your question.
Yeah,
yes.
That's interesting. I thought they had to be tested before they can be sold to, they can be sold.
I agree with you. I agree with you.
Okay, and the other question was about CBD. Now, that's another big popular thing now. Can you tell us a little bit about what CBD is? It's, from what I understand, it's cannabis, and now it's being used to treat a lot of ailments. How safe is it, and how effective are CBDs?
That's a good question. Okay.
Thank you.
All right. CBD is an analog. It's an analog of like a hemp. Okay. That it has its medical use. That's beneficial in medical use. And so about 3 years ago, I think about 3 or 4 years ago is when the drug was approved in Georgia. But before then, California and Colorado, it was there. And I had at that time, they had so many benefits to it. Especially people who had seizures and convulsions, especially for children. Because I had a colleague, even at the hospital, whose child was born prematurely and had so many problems, and they were taking that little baby to Colorado every 3 months to go get treatment before Georgia passed the law here. So as a matter of fact, we all were part of it, to try to force the state, the government, the governor and the lawmakers of Georgia to get that passed, because we all saw, how that drug, not having that drug in Georgia, was having the effect that it was having on families. Okay, so that medication actually it's been used for wide range of conditions. And like I just mentioned, one of them is for seizures and convulsion. It also has good affinity for pain, for people who has pain. And it could be even neurologic pain. It helps with that. Apart from, in Georgia, I think we have it in 3 different formulations. We have it in a form of tincture, where you can, they come in the form of a dropper. They put under your tongue, and they will absorb. And then it will also come in gummy, that people will just take it and chew on it, and it will be absorbed. And then we also formulate that also in topical form, ointment, cream that you can apply directly to the site where the pain is. That also helps. Yes, so that medication has its benefits, okay? It does work. As a matter of fact, it's a very safe drug that actually studies have shown over and over that it does work, okay? And so if you're going to be using it, especially if you're using the tincture where you put it under your tongue, that is going to be absorbed systemically, meaning it will go to your bloodstream. So be careful, some people, because it can make you drowsy, okay? So if you are a first-time user, the recommendation is to use it at night to see how it makes you feel, okay? Don't go use the daytime and then hop in front of a steering and be driving, because you don't know what it will do to you, right? So that medication, when you use it, depending on what you're using it for, it has so many, like I said, it has so many use for it. I have had people come with arthritis, pain in their knee area, that will pick up, that ointment form, for instance, and apply it to the site, and it does work. It will be even more beneficial if you can do the tincture, where you put it under your tongue and also apply at the same time to the area. That actually give you synergistic benefit, because then you have two. It's working in both areas where the pain is, and it's also working through your bloodstream to get to where the site where the pain is. Okay, so yes, so it's a medication, but because it comes from an analog of a hemp in Georgia, it's not a prescription, but pharmacists cannot just put it on a shelf for anybody to just reach out and buy it. Usually we put it behind the counter. So when you go to your pharmacy and you're looking for that drug, usually you have to go to the pharmacist and ask. And then they will ask for your driver's license of some kind, because they want to make sure that you're using it for medical use, but not for recreational use. Okay, so I'm sorry? How would a driver's license tell you that? Tell you what?
Age appropriate.
I'm trying to understand your question. I'm sorry.
You say that you require the driver's license.
Yes. Oh, okay. Now I get your point. Okay. Yes. I guess I didn't finish the point. It's a state regulation. The idea is because it has, it has a hemp in it. Okay. The government wants to know what you are using it for. Okay. So the idea is, so the government we want to know who we are selling it for. Okay. That's what the government wants. It's not really control, but it's control. Okay. Good question. That's a very good question. Okay, so, right, there are two, some are formulated with THC in it, which is the actual ingredient that is found in marijuana, right? And then there's another one also made the same way, but then it's an analog, meaning that structurally is the same thing, but it doesn't have the real THC in it. If you use the one with the THC, and say, for instance, your employer asks you to go for a drug test, yes, it will show that you have THC in your bloodstream. That probably may show that you are using marijuana, example. But then, if you use the other one that has no THC, then it shouldn't show. Okay? So it's before you buy it, depending on what you're using it for, you might want to ask your pharmacist again, this one here, does it have THC or with no THC? Okay? Both of them work. Both of them work. But just that some people actually prefer the one with the THC because it gives you a little bit of euphoria. Then, so that is the only difference. But other than that, that drug work, especially for seizures and convulsion, that has been a big problem for many families. Like I said, before it was approved in Georgia, a lot of families were traveling out of state to get treatment. Okay? All right. Any other question?
I have a question for you over here before we go, okay? My husband is presently using Rytary, which is used for the Parkinson's disease. Can you shed a little light on that?
What do you use for Parkinson's? What is it?
Parkinson's. Rytary.
Oh, okay, Rytary. Okay. 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 I'm sorry. Okay, so that medication is a medication that actually, before that drug was approved for Parkinson, we had other older drugs that we used to use before that came out. But then the older drugs and one of them is Sinemet. I don't know if you all heard about Sinemet, that we used to use. And Entacapone is another one that we used to use for the same condition. But those have so much side effect to them, okay? So the Rytary became the second generation Parkinson medication that came out, okay, to help with memory. And also to also help memory, and most of the time, as we all know, as people, when they have Parkinson, or over time, your voluntary reflexes all affect all of that, okay? So that drug actually is it's fairly new. It's new, but not new. You know, it's been in the market for about 5 years now. And so far, it has shown a very good result in treating Parkinson's disease. The only thing that many people have had problem with that drug is with their insurance, example. Some insurance companies, it's not their formulary. And therefore, when you go to your doctor write it for you, some people have had problems to get the insurance company pay for it, okay? Because they want the patient to use the cheaper drugs, okay? But if you can get them to pay for that medicine for you, it's great. The drug really does work.
What are the side effects?
What are the side effects? Okay. All right. So the side effect for that ranges from gastric side effect, okay, like diarrhea, example, is very common with that. And some people also, when they take it, I've seen people call me in the pharmacy and they complain of drowsiness, example. Have you experienced that problem?
Not much with that one. The diarrhea at first, but we have been using a lot of water to flush the system every time he uses it, so it kind
having
of
trouble
not
hearing.
too bad with the diarrhea.
Say one more time.
And we have been using a lot of water to flush the system, his system, whenever we use it, whenever he takes the medication. So the diarrhea is not a problem.
Okay.
Neither is the drowsiness.
Okay.
Right.
So, okay. So, what other symptoms have you had that?
The only thing that I see that I don't really like, but it's a little comforting because what was the other one? The first one you were taking again? The carbidopa-levodopa used to let the body very stiff, and so he was unable to walk and swallow properly. But this one, the RYTERA, really helps a lot. The only thing is that it makes the body go into a dancing effect, and sometimes you think that his head is going to go off his body, but it's comforting to him.
Right.
Yeah.
Right. Right.
I'm going to let him give you a little more information.
Okay. Okay.
Lots of prayer and praise.
Oh, he's saying lots of prayer and praise. Yeah.
Okay.
You're welcome.
Right. So, and I like what she just said about the fact that they will fly, because one of the side effects that we've seen a whole lot is the gastric. So if you drink water to flush it, that's awesome. Like I said, Parkinson's disease actually is a problem because usually as the disease state progresses, you know, people, the stiffness, swallowing, all those things start to manifest, okay? That drug is supposed to help, kind of calm it down and give you, give you the freedom to be able to carry on with your daily activity, okay? So, actually, like I said, there's a lot, because it's fairly new drug, there's a lot that we also keep on learning about the drug, because what people call to ask, but most of the problem that we've been having is just gastric, and I'm glad that you haven't, in your case, you don't have drowsiness or sedation with it, which is good. Yeah, but as far as drug is concerned, it is very, very good in helping with your voluntary musculoskeletal system, so you'll be able to move around, because people with Parkinson also sometimes they tremble, right? Mm-hmm. They tremble. That drug is supposed to help decrease that.
The only other thing to that is that he has lost a lot of weight.
The what?
He has lost a lot of weight.
Lost weight. Okay. Okay, Ma, I have a question for you. Is he eating well? Do you think the weight loss is due to what? From eating less or what?
No, the eating is super.
Eating the same way, but losing weight.
Yeah.
Okay. All right. Okay, so when you say losing weight, the first thing that came to mind, but in your case, not. Because Parkinson's disease is, again, it affects your muscle, okay? Most people, when they have, during the when the disease progresses, what many people go through is that they have problems swallowing. When you eat, you can't get the food to go down because you see, you need your muscle down here to move, to force food down. What's that? Yeah, exactly. The word is peristalsis. That is the word. But unfortunately, people with that kind of condition, it tend to be stiff. over there, and so they can't move food down. And so they become malnourished because they're not getting nutrient into their system like they're supposed to. But in her case, she said she's eating, but still losing weight, okay? Well, one thing also is that we have also learned, apart from food also, is it's muscle. You know, people kind of, it's something we call muscle wasting. People tend to, their muscle tend to go waste, okay? Because basically, your body don't build. They don't build like it's supposed to be because of you losing that muscle tone, okay? So when that happens, that's exactly how it will feel like, that the weight loss. But usually, it's the food is the problem. They're getting the nutrient to replenish the body, so you can gain weight. It's always been a problem. But in your case, it's kind of not that was what it is. So I don't know. I can explain. I don't know enough for me to say, with certainty as to why they're losing weight. And we can talk more after this. Maybe I'll be able to help you figure it out.
I can't stay because I have to go so he can take the medication. So thank you.
Okay. Any question? Okay. All right. So at this point, I'm going to bring my assistants, Marianne, to come and talk a little bit about our pharmacy and what we can do, or what we do, to help people like you. Okay? So, Marianne.
Thank you very much. My name is Marianne Adomako, and I'm not a pharmacist. I always have to say that. My background is in higher education. I work at a university, but I am Dr. Ken's assistant, helping him and doing the non-pharmacy roles for Complete Care Pharmacy. So now that you have heard about what you need to look out for and all of that, one of the things that I would like to share with you is that, we have all the big boxes, pharmacies, and I never knew that if there was a private pharmacy, an independent pharmacy that was open to me. Years ago, I went to my gynecologist in a building in Lawrenceville, and there was a pharmacy right in there. But what did I do? I went down the stairwell, and then I went to a big box, and I went to stand in line. Okay. Most people don't avail themselves to these small businesses, independently owned, where you get the best service in terms of the pharmacy actually getting to know you, getting to know your treatment, and what best therapies will be good for you. So that is something that I will encourage you to do, if even it's not Complete Care Pharmacy, if there's one in your neighborhood. And I'll also share another example. I'm one of those people that if I get a mosquito bite, it's going to swell and it will itch a whole lot. So one weekend, I had that problem. At the time, I used to work in Clarkston. So on my way home, I stopped by, another one. So I went in there, and the pharmacist was right at the window. And none of the over-the-counter medications used to work for me. Every time I got that type of mosquito bite, the itching will go on and on for about a week. It will swell, and then it will turn out to be a wound, and then it will turn black. So I have all of those black spots all over my legs. So I asked the pharmacist, okay, so these over-the-counter, which one would be best for me? And she just could not be bothered. And I know that most pharmacies are very, very busy between 5 and 6. And she just said, any one of them would work. But if I had gone to an independent, I'm sure they would have taken time to answer my question because they would have seen me as a much more valuable customer. So at Complete Care Pharmacy, we do everything that a big box would do. But somebody like Ken will take time to engage with you and answer your questions, sometimes too much information that may be flying on top of your head, but it's still good. So we also do give all the different immunizations where the flu, COVID, all the different type of immunizations. And the nice service that Complete Care offers is that, if there's a group of people in a location, maybe in a personal care home or someplace like that, we'll actually bring our mobile clinic and we will come and give you whichever medications, whichever immunizations that you need, so in the convenience of your home. Complete Care also deliver medications to you. So, Dr. Ken did talk about the electronic prescription system where your doctor will send your prescription to a pharmacy, or even if you need a refill, you just use your app to request a refill for your medication. If you were using Complete Care Pharmacy and you want that delivered, it will just deliver to you at your door. You don't have to go to the pharmacy. The medication will be sent to you. We have courier services, and then we have all other people also helping to deliver medications to people. Okay, I want to emphasize a little bit about the compounding services. This is what makes Complete Care very different from all other pharmacies, even with independent pharmacies, and that's something that you will not find at at the big box, because we have both sterile and non-sterile medications that could be customized and made for you. Okay, because sometimes some medications are older, you can't find them anymore, but if that's what your doctor wants you to take, then the pharmacist can actually find the ingredients and make them for you. Okay. Also, some people take medications that they cannot take in various forms. Some people, for example, if you have a swallowing problem and you cannot swallow pills, so you need the medication to be made in a different form. That's something that compounding pharmacies do. Whether you need it in a liquid form or whatever, and this could be for children even, something that, a medication that they will need in a different format so they can actually utilize it for the treatment. Okay. And I know that Ken did talk about the home. I'm losing the, is it coming back? But oh, okay. I'm sorry. Okay, so those hormone replacement therapy, that is becoming more and more, because a whole lot of men and women have, when they have those hormone imbalance, do struggle a lot, with all different type of ailments. And I remember one time where I have a co-worker and we were in a staff meeting, and we started the staff meeting and the woman was in a woolen coat. She was wearing a woolen coat, and then sometime during the staff meeting, she then had a fan on. So everybody's like, really, what's going on? You've just gone from winter to summer within an hour. What's going on? But, I was just laughing because younger people have not been there yet. As my daughter would say, is that something that I need to look forward to? So depending on people's needs, needing more balance in their hormones, okay, of different types. This is more of a holistic approach that most doctors are using now. So you are not taking those medications that are already manufactured that give you all of those side effects. But these compounded hormone replacement therapies are much more easy on your body, on your organs, and whatnot. So those are things that your doctors can recommend for you. You cannot find them in many pharmacies, but that is something that we do a whole lot, a whole lot of them. And other convenient services. What other convenient services do we give? If any of you own group homes, we do service homes like that. Sometimes, or even if you have parents, recently, my father-in-law passed away. So when we went to the funeral, and that's my daughter's father-in-law. When we went to the funeral and we had gotten some of the stuff out of the last place where he was, and in his truck, I looked in a box and I saw all of these medications, and then they have their pill bags. And I was like, this could have been much easier for him if they had been using an independent pharmacy that could have done the bubble packing, and put all of the medications, whatever he's supposed to take in the morning, afternoon, and evening for them. So I was telling my son-in-law, this is something that could have happened. Your dad has been going through all of this. That's a whole lot. So that convenience is something that we can offer for you. If you have family members that own personal care homes, group homes, and they have, or even, family members that are taking a whole lot of medication. Not all pharmacies will take their time to do that for you. Every month, they bubble pack the medications, and you just, press the bubble, so you have your medication instead of, now in different families, you have the sandwich generation where you probably have moved your parents in and all of that, and you don't have time, you have to go to work, but you have an elderly in your home and they need that service. We also do that as well, okay? A whole lot of people have needs, and because they cannot find those medication needs in the area, their doctors are sending their prescriptions out of state. Even compounded medications that their pets may need. These are being sent out of state. They are being charged mailing expenses. But we can do everything that you need. Whether it's eye drops, specialized eye drops, sterile eye drops that you need, or you need something for your dog or your cat. I'm not sure that we are in the snake business yet. But, all of those things we can do for you instead of them going out of state. The last thing, we know about all the opium addiction, but people being in pain and needing medication. So now most of those doctors would rather give you a cream to use instead of, you swallowing and becoming addicted to the opium. So some of those creams, people going to these pain doctors, a lot of them are sending the prescription out of state because they are not aware of the different companies right here that can do for them. So if you don't have any of our information, please feel free to get them. Whether you need dermatology information, hormone replacement, or IV therapy information, or the general, we have all of them here. So please feel free. And if you have any questions, please just direct them to Ken, because I am not a pharmacist. Any questions? Okay, go ahead.
So, Mr. Ken, what kind of personal care do you extend to a customer who comes in with a prescription?
Okay, say it again one more time, please.
What kind of personal care do you extend to someone who comes in with a prescription?
Okay. Okay, so the personal care that we do, I mean, for our people coming to get prescription, like Marianne just mentioned, we as a pharmacy, we will, I mean, we know, we know people work, for instance. If your prescription come to us, first of all, we will deliver it to you.
Okay, so that's not what I'm asking.
Okay.
When I come to, if I bring you my prescription and I pick it up back from you within an hour, do you take the time to tell me what are the side effects?
Yes. Oh, yes. Oh, yes.
Because I have seen where they would, on the thing that you swipe your card to make the payment, they themselves will check, no, you don't need any consultation. So are you so busy that you are not willing to give consultation too?
We don't, no, we are not busy that we don't do that. We actually, that is the pride we take. See, that's the difference between our pharmacy versus the drug chain drugstores. We are family-based, family-oriented pharmacy. We want you, the part is there for you to check for us. That is for the state and the government regulation. But we also step in and do our part. Okay, we will specifically ask you, do you have any question for your pharmacist? Okay, and if you do, I mean, sometimes I don't even wait for people to ask me. When I'm giving the medication out, I will be talking to you about it. Okay, this is you have 3 medications here. This is for your pain, this is for your steroid, this is for your antibiotic. And this one here, you take it twice a day, in the morning and at night, take it with food. I mean, I tell you all about it. I give you the differentiation. If the pill come in different colors, come in the same colors, I will make sure I let you know that, look at the pill. This pill here, they're all white, but this is, the smaller one is for that, this one is for that, this one is for that. So yes, that is the pride we take as an independent pharmacy with the people that we serve.
So that means you're telling me what the doctor writes on the bottle then, because the doctor writes that I need to take it twice a day, with or without food. What I'm asking, there are times when the doctor, I will ask the doctor, what are the side effects? And she will give me the minute ones.
Right.
Do you spend the time to say, Miss Ennis, do you encourage people to change their lifestyle so that they can get off this medication because of the enormous side effect that it will bring in the future? Because one, I'm taking one now, but if I constantly taking it, 3 years down the line, they might add 2 more to it because of what comes from this one.
Right, correct.
So that's what I'm asking. Do you spend the time to say, be mindful of this, whether you want to recommend, try to do some changes in your lifestyle to get off it because of the side effect that it has? Because I know that there is at least one hypertension medication, the HTZ, that it tells you that it may cause high blood sugar. But anyone who takes that always ends up being a diabetic. And so you start out with one, and now being a diabetic, the doctor might have to give you 2 or 3. And then that 2 or 3 affects your liver, and then it also affects your kidney or something else, and they have to give you 1 for that. So you end up with 25 as the amount that the lady mentioned the man has in his van. So that's what I'm asking.
Right,
because you
right.
come,
And
you're here
question.
presenting to us, introducing us to your pharmacy. I've never heard of Complete Care before.
Right.
And so for me to come to you, I need to know if this is what you're offering, you're selling.
Right.
Because if when I come and I don't get that, then that's going to be another factor.
And thank you for clarification.
And to add, okay. Okay, so even one secret that I would tell you, okay, that I have seen patients calling him on his cell phone in the evening at any time, weekend, with questions. and he always has time for them, and he will answer the questions. You know, and I tell you that I have no background in healthcare. The only background I have is a CNA license. But I have learned so much. You know, that's not my background at all, but I have learned so much just being with him, because he does so much education. When I'm in the pharmacy, I'm hearing everything that he's telling people. So I am even amazed at my level of knowledge. So I'll let him continue, but you know, that is the crust of what independent pharmacies do. You know, in terms of, this is who you are, these are your illnesses, this is the way you should go, this is what you shouldn't be eating, this is what you can do better. Yeah, but I'll have him finish up.
Yeah, I think you just said it all. So basically, yes, so to answer your question, that's exactly what we do. I do talk about lifestyle changes, for instance. People with diabetes, for instance. I mean, your medication will work better if you exercise with it. It's 100%. Anytime you warm the cells, you get a medication to penetrate. And therefore, you can get the medication to get to the target, to lower your blood sugar, example. So yeah, I mean, the food you eat is always going to be very important, and your activity level is also always going to be very important. Yes. So to answer your question, that's exactly what we do, and that makes us different from the rest of the competitors around. And yeah, and I'm not surprised you haven't heard about this before, because we are independent family, we are a small business. But see, before I opened this complete care pharmacy, like Ms. Rosalind introduced me in the beginning, I'm a clinical pharmacist. I work in a hospital all these years, okay? But then, with knowing what pharmacists today out there treat our patients and customers is the reason why we brought the hospital pharmacy into the retail world. So in our pharmacy, we even mix IV drugs, okay? We mix IV drugs. In other words, you can't get that same service from the drug chain companies. Like I said, during the COVID time, doctors were sending prescriptions to me, and I was mixing it and giving to nurses to pick it up to take it to people home to be infused, so they can avoid going to the hospital, example. Okay, so we have so many other equipment that we use in our pharmacy that other places don't have it. So basically, we are different kind of pharmacy. We care about the people we serve, and we tell them everything they need to know. I hope I answered your question. Okay. All right. Thank you so much.
Okay. Would like to thank Ken and Marian for coming today. Also, I'd like to say a special thank you to Jean, Jennifer, Yulene, Jillian, Sandra, and for all those who have helped me during the course of health ministry. It's just a pleasure working with them. And I just didn't want to miss that today, because I know the last time we had health ministry, I didn't say thank you to you all as I should have. But I'm just saying thank you, and thank you, Ken, for coming. And I hope what you all hear today, it was knowledgeable and encouraging for you all, and we can move on from there. Thank you very much.
Okay, we have more questions. I think we might be able to take that last question, and then we wrap up this segment for the afternoon. One last question.
Can you hear me? It's very simple. How long have you been in service? How long have you been serving the community with your medicine?
With my pharmacy, you mean?
Yes.
Okay, so we opened in 2019.
Oh.
So we've been here about 3 years.
Another question. You know, with the medications that you talk about that have side effects, do you have studies on it? Do you have people that, you know, you run these tests on to see what the side effects are?
My hearing is not that great.
Can you hear me? Because, I mean, how do you get your information to say that these are side effects?
Are you talking about, okay, so I'm hearing your question about side effects. Are you talking about prescriptions?
Yes.
Oh, okay, so her question is about prescription drugs, you know, and the side effects. Mm-hmm. Do you run tests? But, you know, those are already done by the drug companies, right? Oh. So respond to that.
Okay, so your question is if I run tests of side effect of medication?
Studies. The word is studies. Do you have any case studies going on to say 10 people, you know, are taking placebos, or there's another 10 that might be taking the medications, and then you came up with the side effects?
Okay, so that question...
How accurate are they?
Okay, that question you just asked, that question come with during the approval state. Okay, that part is done by Drug Enforcement Agency and the drug manufacturers. Usually, we have all that information there. So we, as a pharmacy, don't take our time to do that because that is not what we do. When that go through the government agencies, which is the Drug Enforcement Agency and the drug manufacturer before they approve it. But then if you come to the pharmacy and you have specific question as to how many people, when they took the drug, how many percentage got XYZ, yes, I'll be able to refer and tell you. But that's not something we, as a pharmacy, will do.
Thank you.
Okay.
Thank you, Dr. Ken, and thank you for taking your assistant here with you. I have personally learned so much this afternoon. And here's how we'll fix the other questions that you might have. We have cards up here. We have brochures. Please grab one before you go so that you will have address and contact number. And this is the doctor's way of saying, I want you to reach out to me. So please make good use of this opportunity. Thank you again for taking the time to come. We put our hands together again, show our appreciation for your coming to be with us this afternoon and informing us. May God bless you and your business and as you continue to serve the public. We're going to close right now the way we began, thanking God for seeing us through this session. We know that God desires that we should be in good health. Loving Lord, we thank you, the one who made our bodies. We thank you, the one who gives knowledge so that we may take care of these bodies. I want to thank you for Dr. Ken and his team. We ask now a special blessing upon his pharmacy and his business. And this is really a ministry because our bodies are the temples of your Holy Spirit. And so we commit and commend him, his team to your care. Every person here listening, pray that you will guide us as we take care of our bodies and seek toward better health. May your Holy Spirit be our constant guide and companion, always, forever, throughout. And in the end, help us to give all the praise, the glory, and the honor to the one who is altogether lovely. We praise your name. In Jesus' name we ask these. Amen.
Can I say something? Just wanted to say something.
Intimate songs, sweet tender words, flowing between heaven and earth. You whisper to me and I sing you a song. As you play the music, I'm carried along. I am in awe, I am in love. Breathing you in, I can't get enough. can touch your face. Can the time stand still? Do I dare to ask? Can the world move on and this moment last? Can we stay right here? Stay right here. Here in your arms, I am at rest. My silence conveys what my words can't express. I am amazed at the wonder of you. To soak in your presence is all I can do. Can we stay right here in this holy place where you feel so near? I can touch your face. Can the time stand still? Do I dare to ask? Can the world move on and this moment last? Can we stay right here? Stay right here. Stay